and for everyone coming together today in the new year at this Addiction Policy Forum. And as I look around this room, I know that there are so many of you on the front lines who have devoted yourselves to making a difference, to ensuring that we end the stigma of those who are suffering from substance use disorders, that we come together to address what truly is a public health crisis for the state of New Hampshire. And I'm very honored to see leaders in our state here who I know are working as hard on this issue, because their presence today shows you that doesn't matter if you're Republican, Democrat, Independent, an alien, we are going to be here together working on this issue, because guess what? Addiction doesn't care. And those who are struggling with addiction, they come from every single background. And so it is incumbent on all of us to address this crisis together. So I want to thank my colleagues, Congresswoman Custer, Congressman Ginta, who are here today, the Attorney General, State Police, Bobby Quinn is here today. But as I thought about coming here today to talk in this forum, so appropriately, here we are, Happy New Year, 2016. I thought about 2015, and I thought about the year that we've had in the state of New Hampshire when it comes to the public health crisis we have been facing with opioid addiction, struggling with heroin, deadly drug fentanyl, overuse and misuse of prescription drugs, and of course all the substances that people struggle with every single day in this state. And so it's a tale, it's two different tales really, as I think about 2015. 2015, we look back at 2014, we had 320 drug overdose deaths in this state, and that was staggering. That was a 60% increase from the year before. 2015, mid-December, our chief medical examiner reports 340 overdose deaths, so the 60% increase, even higher. And unfortunately, the chief medical examiner, that was mid-December, he estimated that we were going to see 400 this year in the state of New Hampshire. And as of mid-December, 151 of those actually he's specifically attributed to also the deadly interaction of fentanyl, which is a real killer that I know both the state legislature is focusing on, and I'm certainly focusing on at the federal level. Over the last year, I had the opportunity to do a ride-along both with the Manchester Fire Department, the Manchester Police Department, and the stories were the same. Our first responders every day are struggling. They're saving lives, they're administering Narcan, and you don't have to be with them long to unfortunately experience going to an overdose. And to see individuals on the floor who are really in the last gasps of life, and to see them bring them back, and to understand that this happens in every single household. And having had that experience over the last year, I'm grateful. I want to thank all the first responders in the room because they are doing a phenomenal job. I'll tell you this, it's very, very tough. All of you who are out there working, you need our support because seeing that day in, day out, it wears on you. And so this is the cycle that we have to end in 2016. But I also wanted to share with you what my experience has been in 2015 and before that with this crisis that we're facing. And this experience is a very different experience from the one I just talked about where people are dying, and that is in this room. The courage I have seen, the resilience I have seen, the determination, the people who are in recovery, who have had the courage to come forward and say, guess what? I'm in recovery too. I struggle with addiction. I have turned my life around, and I'm I see that, I know that we can turn the story around. Not only the decades that Jessica talked about, but turn around 2015 and this new year. When we look at our resolution, this is the perfect timing for an addiction policy forum to have a different 2016. And I just want to cite a couple of examples. I'm looking right in this front row. I'm looking at Doug and Pam Griffin, who tragically lost their daughter, their beautiful, incredible daughter, Courtney, 20 years old. And their experience, they are taking that and they are working so hard to establish the Courtney Griffin Sober House. So that's an example of inspiration for all of us. Other inspiration, other issues that I work on are veterans, and so many, our veterans struggle with substance use disorders so much. And I had the chance to meet my friend Keith Howard, who has the Liberty House here in Manchester. And I remember standing in a presentation on Memorial Day where he talked about his addiction to heroin, how he was homeless on the streets, and how he turned it around, and how his struggle with addiction, he turned that around and opened the Liberty House to help homeless veterans. So I think about inspiring stories like that. And as I've met so many of you in this room, you are doing this as well. These are just a couple of stories. Each of you has a story of how you, in your experience of a family member, a close friend that you've lost, that has struggled, that you've turned this around. Whether that is opening up a new treatment facility, my friend Melissa Cruz, Hope for New Hampshire Recovery. As Jessica talked about being discouraging, let's think about the people of courage and how we can be encouraged going into 2016. And so I wanted to talk about what we recently did at the federal level in terms of the appropriations bill that was passed at the end of the year. Because I think there's some very positive signs in the funding bill that was passed at the end of the year that I want to share with you. Those signs are just the beginning, because as Jessica said, my priority in 2016 is to get CARA passed, because that to me. But this appropriations bill did have some positive signs. And one of the things that I think we need to talk about today in New Hampshire, all of us who are working together, is how do we take what was passed also at the end of the year that has some additional funding to address substance use disorders and also co-occurring disorders with mental health, to make sure that that funding comes to New Hampshire. And that is incumbent on all of us to work together to make sure that we can address this crisis and make sure these resources come. Some of the things that happened at the end of the year: a total of $123 million, an increase of $91 million, or 284% over fiscal year 2015 levels heading into this next year for CDC and SAMHSA related to combating opioid abuse. So a very positive step. And I want you to know this is something that I was proud to work across the aisle, that people came together on a bipartisan basis for some of these increases, knowing we need to do much more. In addition to that, $70 million for the National Center for Injury Prevention and Control at CDC to assist state efforts to support evidence-based opioid overdose prevention programs. We know we need a prevention campaign. We know we all need to work together to get in at an early stage to talk to not only our children, but to talk to everyone about how do we prevent, how do we stop people from obviously engaging in trying heroin for the first instance. $211 million for SAMHSA substance abuse prevention, including $12 million to assist states with Narcan distribution and training. Obviously, we all hope that we need less Narcan for our first responders, but we better make sure that they have it to save lives. Additional funding also focused, most importantly, $2.1 billion for substance abuse treatment and prevention within SAMHSA. And most importantly, the block grant that comes to New Hampshire comes to every state. There is a $38 million increase overall nationally in the block grant that comes to New Hampshire that gives that flexible funding to states. And we better make sure that we understand how do we ensure that New Hampshire is able to access these resources that are in this bill to the greatest extent possible. Designated within the $2.1 billion for substance abuse treatment and prevention within SAMHSA, there is a specific designation for targeted capacity expansion activities to address prescription drug abuse and heroin use. So that is a recognition at the national level of the struggle that we are engaged in right now when it comes to opioid addiction here in New Hampshire. So I wanted to mention what we did at the end of the year, and that to me is an important first step. And working together to make sure that this isn't just something that happens nationally, but that we all work together to ensure if it's a competitive grant process that we're able to bring this here to the state of New Hampshire. Other steps that were taken over this year. Unfortunately, we know that this opioid addiction is not just hitting those of us who are adults or young adults, but it's hitting our babies and our infants too. We have seen nationally a 300% increase of infants that are being diagnosed with withdrawal after being exposed to opioids in the womb. And so we need to have support for mothers and new mothers. And I know some of you in this room are working very hard at that. But at the national level in November, the president signed into law a bill called the Protecting Our Infants Act, which I was proud to co-sponsor. And this legislation is going to focus at a national level with the Department of Health and Human Services to develop a strategy to address the alarming number of infants who are diagnosed with newborn withdrawal after being exposed to opioids. And of course, that also means that we need to make sure that we're supporting the mothers. And that goes back to the issue of treatment capacity, making sure that we have support for recovery, all of the issues that you were all working so hard on. So what more do we have to do? So much more. I know that. I want to be a partner with you. You're on the front lines. I want that my office to be a resource for you. I know we can't solve this all from Washington. This is really going to happen at the ground level. My hope is, though, at the national level, that we understand and continue to keep the focus on what we need to do to turn this around, not only in New Hampshire, but across this country. And in my view, the CARA Act that Jessica references is a very, very important act. We brought together, in order to put the bill together, 100 stakeholder groups across the country. It focuses on prevention. It is called the Comprehensive Addiction and Recovery Act because we understand it's a bipartisan bill. It's being led by Sheldon Whitehouse, a Democrat from Rhode Island, Amy Klobuchar, Democrat from Minnesota, myself, Rod Portman, a Republican from Ohio, and we are continuing to get more and more sponsors for this every day. So in your communities, I ask you to reach out and ask, make sure that we get senators of every party on this bill so that we can get this passed this year, because it is my #1 priority. And I know that we're going to have a few presidential candidates here today, by the way. And one of the things that New Hampshire, we've seen the presidential candidates come here and share their personal stories of their families and how they have struggled with addiction. And certainly, to me, this is also an opportunity to say, in your presidential campaign, will you make this a priority for the nation? And so I think we have an opportunity here, you have today, in this state, to make sure that we continue to focus on a national level so that we can all work together. Before I end, I want to talk about fentanyl for a moment. And I know that I had the opportunity to go visit recently the Granite House. Eric Spofford, who is the CEO of Granite House, he also has just recently opened the New Freedom Academy, which is going to increase treatment capacity in Canterbury. He himself is someone who is in recovery and was addicted to heroin and decided to turn his life around and to create an opportunity for others to recover and to be in recovery. So one thing, I thought the description that he gave me recently of fentanyl was an accurate one. He described fentanyl to me as a serial killer because fentanyl is 50 times more powerful than heroin. And yet, unfortunately, we have drug dealers who are wantonly mixing fentanyl with heroin, or sometimes people are getting almost a pure dose of fentanyl. And so when our chief medical examiner talked about the 340 deaths we had by mid-December, 151 of them related to fentanyl, there needs to be a recognition that fentanyl, heroin is certainly a killer, but fentanyl is a serial killer. And so at the federal level, based on recommendations from working with law enforcement, I have introduced a bill called the Stop Trafficking in Fentanyl Act to reform the penalties for fentanyl. Because right now, fentanyl is not in line with heroin. In fact, it's the penalties and how this drug is treated at the federal level is not in recognition with how powerful this drug is. And we need to send the message as we think about the interdiction end for law enforcement that you better not as a drug dealer mix fentanyl with anything, or you are going to be held accountable. So I know that you're going to hear from so many speakers today who are passionate about this issue. I just want to end by thanking all of you. Thank you for what you're doing every day to make a difference in the state of New Hampshire. Count me in as a partner. I want to hear from you about what else I can do to help, what we can do to make sure that 2016 is a very different year than 2015, that we resolve as we start this new year with this Addiction Policy Forum, we resolve to have determination. We resolve, as discouraging as this can feel, that we do not lose hope, that hope is what shines into 2016, that we all resolve together that we are going to save lives in 2016, that when we come together next year, that the numbers are not going to be increasing, that we're going to be going the other way, that we can make a difference in 2016. So thank you for having me today, and thank you for all that you're doing.